I had no movement in my hip. That's something that people have a very hard time understanding, even medical people. When I say no movement, I had absolutely no hip movement whatsoever. My name is LaVonne Martin, and I was born with a dislocated hip that did not stay in place. I had a lot of surgeries when I was young to try to keep my hip in place, and it wouldn't stay. I have seen doctors all over the country. I've seen dozens of doctors, and Dr. Linschoten right here in Baton Rouge was the only doctor who would even have a conversation with me about it, and frankly was the only doctor who has the skill and the expertise to take on something like this. You know, I'd kind of grown up with orthopedic surgeons. I saw more orthopedics probably than I did pediatricians. Dr. Linschoten was so different than all the other orthopedics I had ever dealt with. And I guess the main difference to me was most orthopedics just sort of always told me how it was and how it was going to be. Whereas Dr. Linschoten had a much more team approach. He wanted input, obviously from me, but my husband went to many of the appointments with me. Post-surgery, he asked my physical therapist to come to an appointment with me. He consulted his PA on some different things, and I always felt like it was very much a team approach, and I'm very comfortable with that. Now, there was no question that he was in charge and he was the quarterback, but he really wanted to know what everyone's thought process was. And he's just very approachable and very involved with his patients. He just really has an interest in making people's lives better. It's not just a routine, how many hip replacements can I do today? Dr. Linschoten's approach is very holistic in how can I best serve the needs of this patient with what I have to offer.